Hello, sir. Thank you very much, and congratulations. We got a chance to talk right after the vaccine was authorized, right after it was, rather, the data first came out, and now we have the first conversation after it's authorized. Let me wish my congratulations to you.
Thank you very much. And indeed, it was like yesterday that we had this discussion.
Have you taken the vaccine, sir?
No, I haven't taken it yet. And we are having an ethical committee dealing with the question of who is getting it. And given that there are very strict allocation rules that the CDC has voted, we are very sensitive not to cut the queue and have people getting vaccinated before. So still, I think this committee recommends that I will get vaccinated because polls that we have seen said that people will believe much more on this vaccine if the CEO is getting vaccinated. So likely I will get it.
Let me ask you about the amount of vaccine available, because as you were just listening, I'm sure it's been a source of a little bit of confusion. When we last spoke, and again, this was after the first data came out a few weeks ago, you told me there was around 6.4 million doses that were going to be available at the time shots first started getting administered. Is that still the case? And how quickly can you manufacture this vaccine? Do you think about this on a per week scale, per day scale? Give us some context here.
Yeah, it is true. And actually, this year we will have around 50 million doses available, of which most of them have already been manufactured. So the doses are there available. Next year, we will do 1.3 billion doses. And of course, those numbers are global. For example, from the 50 million doses that we are going to manufacture this year, approximately half will be allocated to the US and half to the remaining of the world.
So roughly 25 million doses here in the United States, 25 million around the world. And what about next year? You say over 1 billion doses next year. That's a phenomenal number. What percentage of that will be in the United States manufactured versus around the world? And what number will be available in the United States versus around the world?
Yeah, it's, as I said, more than one, you are right, 1.3 billion doses. And we are working very diligently to increase this number because we understand that the demand is very high. We are having one manufacturing line here in the US involving 3 manufacturing sites. Kalamazoo is the last end of them, but we have one in Wisconsin and one in Massachusetts. And we have another manufacturing line in Europe, Belgium, Puurs, and in Germany, 2 manufacturing sites involving also our partner BioNTech. It's approximately half-half, a little bit more are produced in Europe. The European manufacturing site has higher capacity than Kalamazoo, but we are maxing capacity on both sides.
And from what my understanding is, sir, is that for next year, 100 million doses will be actually being administered here in the United States. So that means, according to what you're saying, that 1.2 billion roughly will be administered in other countries around the world. Am I hearing that right?
So far, we have an agreement with the U.S. government to provide them 100 million doses, and this is a fixed order. And we will provide those 100 million doses starting from now by the end of the first quarter. And we will honor this commitment. But the U.S. government is asking more. They have asked now an additional 100 million doses from us. We are trying to, we can provide them the additional 100 million doses, but right now most of that we can provide in the third quarter. The U.S. government wants them in the second quarter. So we are working very collaboratively with them to make sure that we can find ways to produce more or allocate the doses in the second quarter as well. But we haven't signed this agreement yet.
I'm curious, do you have any concerns as the amount of manufacturing that was for the clinical trials? That was obviously tens of thousands of doses. Now you're manufacturing tens of millions of doses. You're going to go to over 1 billion doses. These are huge jumps up in the overall scale. How big a concern is that in terms of getting enough of the raw ingredients, the manufacturing capabilities, and then all the quality checks to make sure that the quality doesn't diminish as you manufacture more and more? Is that a concern for you?
That the quality will be diminished? Not at all, because we have so strict rules that we not allow anything to go out without meeting the high standards of quality. So the 1.3 billion that we believe we will provide, they will definitely meet the highest standards of quality. Look, it's not an easy thing, so it's quite complicated. And there were a lot of things that were making me worried. Much fewer now. Already we know how to do it. And although it looks like a giant step, for us it's what we do every day. So right now, I feel quite comfortable that we will be able to do it smoothly. I'm sure that there will be bumps all the way across the way, but also I'm certain that this is normal life for us, and we will be dealing with them, and then we will deliver these quantities. And as I said, I hope that we will deliver more.
We got a couple minutes left. I brought up this point that I think is very important, and I'm hoping you can just clarify this. If we can show the graph of what happens with a single dose of the vaccine. Now, I know all the trials were done on 2 doses, but I don't know if you can see this, sir, but the audience is seeing this graph from the FDA Pfizer's kit of data that went out. The red line is coronavirus cases going up without a vaccine. The blue line is about the 10-day mark after a single dose, where you see a significant flattening of new COVID cases. The single dose appears to have a lot of benefit, not as much, as it turns out, as 2 doses. But in the middle of a pandemic, do you think, and I realize it's an FDA and CDC sort of decision, but as CEO of Pfizer, do you think there's merit in the middle of a pandemic, when there's such demand, to giving 1 dose to as many people as possible, and then manufacture, just as you were describing, the second dose very rapidly to provide that dose after about 3 weeks or so?
Thank you. I can't see the graph, but I have it already printed in my mind very well. It's a very, very important graph from public health perspective, because indeed shows that already from 14th day, which is 2 weeks after the first administration of the first dose, you can see the lines getting separated. And if you can measure around the 21st day, which is the day that we are giving the second dose, there is a theoretical efficacy of approximately 50%. But this is not something that we know can continue. And definitely it's not as high as the 95, is almost half of it, that you can get with the second dose. This was something that both FDA and CDC considered a lot. And they are rightly, I think, recommending that you should complete the second dose. However, it is a very, very important graph, because from public health and from epidemiological point of view, we know that we will have an impact already from the first dose.
How are you spending the day today? Are you going to go see any of these people who are being vaccinated for the first time?
Actually, I'm going to our vaccines research center in a few hours, and I'm going to see some of the people that made this vaccine available. It is here in New York, in Pearl River, our site, and this is where I'm going to spend most of my day today.
All right, sir. Well, we thank you for spending some time with us. I know it's going to be a huge distribution and logistical challenge, one of the largest logistical rollouts we've ever seen really in our history. So we hope you'll come back and talk to us about how that's going in the days and weeks to come as well. Thank you.
I will be available at your disposal. Thank you very much.
All right, sir. Allison, there you have it. I mean, we're going to see how this plays out. There's certain to be some hiccups today, but I get a little bit more clarity on exactly how the thinking sort of shaped this rollout and what we're likely to expect.
Sanjay, great interview. We got so much information there. I thought it was, at the very end, very interesting, because I know we've been talking about why not just vaccinate as many people as you can and then keep your fingers crossed for the second dose. And I thought that it was interesting that he said that they decided that didn't work as well. However, that we will see the effect on public health from the very first vaccines today, which is great news.
That's the key. Yeah, I think that's the key. I mean, everyone keeps asking this question, and it's true, the vaccine is not an immediate it's such a powerful tool, but not an immediate tool. But where are those benchmarks where you're going to start to see benefit? It's a vaccine that can greatly reduce the symptoms and the disease of COVID-19. So the earliest impact may be on death rates, which is so critically important. And then slowly after that, we'll see hospitalizations and case rates fall. So it's almost like looking at things in reverse order. Saw case rates go up, then hospitalizations, then death rates, that lag time. With the vaccine, death rates affected first, then hospitalizations, and then case rates. You know, it's a lot to absorb. I realize 7 o'clock in the morning, but I think it is fascinating. And obviously, as it rolls out through the day to day and the weeks to come, we're going to pay a lot, very close attention to this.
It is fascinating, Sanjay, and don't go far because you're going to be with us all day long as people start getting these vaccines. We will see people getting the shots in their arms, and that will be, like I said, a triumph of science.